This is a repositioning sling. It is designed to stay under the patient. It is used for boosting, turning, and laterally transferring.
My coworker and I are going to boost you and turn you onto your side.
Okay. Adjust the height of the bed to the upper thigh level of the shortest caregiver.
Great.
Position the carry bar parallel with the patient's spine and secure the straps onto the hooks with the goal of keeping the patient horizontal once they are lifted. The patient's head can be supported on a pillow on the sling.
Are you ready to be lifted?
Coverage of the sling must reach at least the mid-thigh of the patient. Raise the sling until the tension is on all the straps and the patient has begun to clear the surface. Move the patient up in the bed and then laterally. Detach all of the straps from the side that the patient is to be turned towards. Consider when the bed rail needs to be either up or down for staff and patient safety. Cross the patient's leg. Make sure that the arm the patient is going to roll towards doesn't get trapped underneath them by crossing it over their chest. Position the patient for comfort and safety. Detach the straps and flatten out the sling. Remove and charge the ceiling lift and lower the patient's bed. If your patient only needs to be turned and they don't need to be boosted, you can turn them by just attaching 1 or 2 straps somewhere between their hip and shoulder level.